Hostels, they are not able to get drugs in hostels, and so they have to go and procure drugs
Senator,
outside.
you
How
have asked
does
your
this
question.
address this problem?
You have asked a question. Senator Dulo?
Thank you, Speaker. Waziri, there are some dispensaries within our counties that have stalled under Equalization Fund. I have 2 of them in my county, one called Akadeli and one called Shambani. Those dispensaries were constructed way back in 2019. Even after the ruling of the court case to pay the contractors, I'm asking. Waziri, those dispensaries are vandalized and the counties are passing back to the national government. Are you aware of the same? Thank you.
Senator, what is your point of order, Senator Eddy?
Madam Speaker,
what is the issue?
Understand order 1, Madam Speaker. I'm just requesting you that I understand the sensitivity of time, and there are so many questions that have been asked. Through your honor, Madam Speaker, may we postpone all those other questions, but the CS answers
Senator
the question
Eddy,
of
please sit down. Senator Eddy,
UHCs.
I have ruled on that question. I have ruled on that question.
I'm not overruling you, Madam Speaker. I'm just
Senator Eddy, sit down. You're actually being a nuisance. Senator Cherargei, 1 minute. Order, Senator Oroba. You are not co-chairing with me.
Madam Speaker, if they continue disturbing you, invoke 122. Standing 122. Madam Speaker, could I ask the Cabinet Secretary?
Senator Eddy, can the Sergeant at Arms escort Senator Eddy out?
Madam Speaker, can I ask? Can I ask the
Proceed,
question?
Senator.
Madam Speaker, thank you. Could I ask?
Order, Senator Eddy. Order, Senator Eddy.
Could I ask the Cabinet Secretary that in light with the court's decision that the verification committee that he formed was unconstitutional and illegal, how is he going to ensure verification of NHIF pending bills and ensure, Madam Speaker, we have both verifiable and unverifiable under NHIF? Because I told Waziri when he appeared that under Article 229 of the Constitution, the Office of the Auditor General should be the one verifying the pending bills. What is his options on the table? And I gave him for free. I didn't even charge him. It was
Senator
pro bono.
Cherargei, please sit down. Before the minister answers, Senator Eddy, please withdraw from the House. Senator Eddy, please withdraw from the House. Sergeant at Arms, pursuant to... Sergeant at Arms, please assist in withdrawing Senator Eddy from the House. CS, can you answer the question?
Thank you.
Order, senators, please. Order, senators. Order, Senator Eddy. Honorable senators, pursuant to Standing Order 121, I cite you for disorderly conduct, and I have cited you for disorderly conduct. Senator Eddy, I have directed that you leave the House. The Sergeant at Arms may now proceed to move him out. Senator Eddie, I have directed that you withdraw from the House. Sergeant at Arms, we will not proceed unless you actually escort Senator Eddie out. Please do not defy the chair. Eddie, I am ordering that I'm directing that you withdraw for the remainder of this sitting, please. All the members who are around Eddie, please go take your seats. Take back your seats. Senator Beatrice, Senator Gloria, please go take your seats. Senator Beatrice, Senator Gloria, Senator Kavindu, please take your seats. Senator Korir, what's your point of order? Senator Korir, is your point of order still relevant? Can we listen to the CS, please? Please, let's listen to the CS. CS, please.
Honorable Speaker, the Honorable Senator from Mombasa, Bofaki, I want to assure you that there are no prepayment of 2 years. The SHA Act promotes,
Order, Senators,
provides for 1 year annual payment for informal sector. However, currently, Kenyans who are registering are only paying monthly premiums. On Honorable Senator Fosiolo, we shall engage with the National Treasury and we shall engage with the county governments. Equalization Fund is administered outside my ministry. It's under the National Treasury. It has a secretariat. It is members of parliament, leaders who choose what to do. But I think I will contact the National Treasury and the Council of Governors. Honorable Gloria, there are many, they are covered, in fact. And if you look at the comprehensively, what I have tabled today, you will see it. But further, you need to look at the tariffs of the healthcare service, which was, no, I'm telling you, you need to look at the healthcare service where there was a legal notice number 556 of 225 as gazetted, and it provides for a complete cover. So you go to the benefits. Maybe the facility you went to played a games on it. On Mombasa, Coast General Hospital, on, yes, get us and the date and everything, and we'll ask him. On Coast General Hospital, let me first thank the governor of Mombasa. That county is leading in terms of SHA registration at 58. And we must thank him. He has, the person second to him is like the numbers between the numbers for Liverpool and Arsenal. The difference is 10. So that is how he's ahead of the pack. But on SHA pays all approved claims by the 14th of every month. And I will give you the figure. As of today, 228.37 million have been paid since SHA came into place in October. If the claims are not verified, and the governor knows, he talks to his people, I have sent him the bills, he has verified, and he is very comfortable. And tomorrow, in fact, he'll be in Nairobi. He will sit with our team on digital health to make sure that his system works seamlessly. Senator Kavindu, SHA registration is seamless you can use the USDD, you can use your phone, *147#. You can use the community health promoters. If they are teenage mothers, which we have a number, we are giving them temporary cards. So it's very seamless. Nobody should. Unlike NHIF, where you need, after you register, you wait for 2 months. SHA is as you go to the hospital, if you register, the system picks you. The only system-related issues, and then if you have any system-related issues, then you call our call center, which is 147, and is available 24/7. And the call receiving is at 0. It was 2 minutes. Now, once you call, in fact, very soon we will call back Kenyans to ask you, why did you call and you dropped the call? That's how it is. I think there was a question on the fund by Senator Beatrice, on the 3 fund under SHA, and the KEMSA. Do we have drugs? I want to assure this House that KEMSA is undergoing a reform, recapitalization. Through the private sector, we are putting about 10 billion to increase their fill rate to 100%. So drugs are available at the last mile. On the doctors in Kakamega and many other places, as Honorable Khalwale was asking this question, I texted the governor of Kakamega. Whether it is true or false, I told him to send me the agreement he has signed with the doctors. He is yet to send me, but he said, I have resolved. There are about 18 counties where doctors have issues, and I have agreed with the union when I was in Mombasa that those issues must be resolved. Kiambu is one of them. And I'm talking to the governors that we resolve. The main issue is on promotion. Consultants, senior doctors have stagnated for a long. But as you know, health is devolved. There is a committee on health here, chaired by by Honorable Senator Mandago. There is a committee on devolution by the Senator of Wajir. I think you'll do much better if you deal with this matter. But on the matter of UHC, Honorable Chair, lastly, the people out there were with me. We have signed an agreement with them. And I am not budging back from that agreement. Because when leaders agree with you, an Honorable Senator, with a light touch, Honorable Cherargei, I will come to answer his question. He's looking at me. It's the last one. But UHC, I've answered you as you are talking to somebody. Honorable Senator. I started with you as I said, Equalization Fund is under the National Treasury. There is a secretariat. It's members of parliament who
Yes, you have under a minute.
Yes, so I have answered that question. So on UHC, the question is budget. Who makes a budget? The budget is made by parliament. I told them, leave my door, come to parliament. Today, this week is a budget making process. You deal with the division of revenue bill, you deal with the county revenue allocation. I'm sure you'll add some money to the counties. Please do me a favor, cut some money, give to UHC. I will pay them. I am struggling. And
CS,
finally, Honorable Cherargei.
CS, Senator Kavindu as well says you have not answered her question.
I have answered her question. Maybe she was not hearing.
He has 1 minute. Let him finish.
But let me answer the question of Honorable Cherargei first. And Honorable Chair, as a good friend of mine, he's the last person I will take advice from. He's the last person. I will never take the advice of Honorable Cherargei. Because if I take, I will not even cross the road. But on the pending bills, by law I have established, Kenyans have the right to go to court. They have gone to court. Those who claim those bills, they have to wait until the court makes a determination. I mean, one arm of government has done its job. Another arm of government has injected
Senator Kavindu, quickly.
Senator Kavindu, maybe I can listen to.
No, the question, just say what.
Notice we are all straining to follow the proceedings. And Mr. Speaker, I've consulted the Sergeant at Arms. That noise you're hearing is from doctors, clinical officers, and other members of the Universal Health Care, UHC. Mr. Speaker, could you resort to standing order number 1? You suspend the sitting for 5 minutes so that we can go and receive the memorandum. hand over to the minister since he's now here. He has deliberately, Mr. Speaker, refused to talk to those doctors. And that's why they have strategically come when he's here, so that then we can hand over to him and interrogate. If need be, you order him to go and receive that. Both exits are blocked.
Senator,
Mr. Speaker, sir, before, Mr. Speaker, Mr. Speaker, in conclusion.
Order, senators, let's listen in silence.
Mr. Speaker, in conclusion, you recall on the 25th of June, that is how the National Assembly continued ignoring. As people pushed, they were continuing to vote. Let us respond to the public, hear them out, so that for the first time, we capture the minister for these members of staff who have found it impossible to get in.
Order, senators, order. Order, senators, we are running out of time. Senator Buni Kalwale, although you're raising a valid point, we are not voting on any matter today. You can ask your staff at your office to go and receive the memorandum, or you can go receive the memorandum and come and put the question to the CS here. So Senator, yes, Majority Leader, what's your point of order?
For 10 seconds, on an issue of procedure, Mr. Speaker, yesterday at SBC, we passed an agreement that whenever we are handling this session and we are pressed for time, we give priority first to members that initially drafted questions before supplementary questions. I wanted to request, given how much time is spent, that you kindly bear with us. Even previously with the other ministers, that's what the speakers, the substantive speaker did, that you allow the two members who had questions to finish their questions. The minister responds. If there is time left, Mr. Speaker, I would humbly plead that we do supplementary questions. And also, Mr. Speaker, I don't know who shared out my number, but I have more than 1,000 messages from UHC staff who want specific answers from the minister. It will be unfair if he leaves the House today before addressing himself on these issues of UHC. So I plead for your indulgence.
Thank you. Thank you. No point of orders. No point of orders. Senators. Senator Cheriot, I think we will proceed as you've requested. It will save us time because we're really running out of time. And I wish we would stop all these point of orders so that we can manage our time properly. So, Senator Ojienda, we are going to proceed to the next two questions, and then we'll take supplementary questions, all of them at the end.
Mr. Speaker, just on a point, may I then, I will assign my supplementary questions to the Senator for Vihiga for one question, Senator Muma, Senator Faki, and lastly, yes,
Senator Eddy, it's okay. Senator Sifuna, please ask your question.
Mr. Speaker.
Thank you, Honorable Speaker. Although the CS was saying he's not in a hurry, we need to remind him that he came late. And therefore, it is the reason why we are running out of time. And he knows the House rules that there is a time for the rising of this House. Honorable Speaker, I want to ask question number 32. Honorable CS, could you tell us why was the Edu Athia medical scheme, which provided comprehensive medical insurance for secondary school learners under the National Health Insurance Fund, discontinued under the current Social Health Insurance Fund program? And secondly, what are the reasons for the government's failure to provide last expense compensation for Mr. Elias Majau Muta, whose son, Master Robin Murimi Majau, a Form 3 student at Kibera Secondary School, passed away on 9th September 2022. Now, Honorable Speaker, I have looked at the response that the CS has given, and in the interest of time, maybe he can just be brief, and he has asked in the response that I provide certain documents. I would like your clarification or direction, Honorable Speaker, because I have those documents here with me, and I want to put them in the CS's hands. I don't know how that is going to happen, but I will await your direction.
What's your point of order, Senator Eddy?
Madam Speaker, I'm raising understanding order 101, Madam Speaker. I mean 101 and standing order number 1, Madam Speaker. Madam Speaker, what Senator Boni Alwale has brought in this House, Madam Speaker, and requested your chairpersonship to rule on is a critically important one, Madam Speaker. As we're speaking right now, Madam Speaker, the healthcare structure is all in disarray with these strikes, Madam Speaker, because of the UHC strikes, Madam Speaker. If they are outside here, Madam Speaker, and this House, we make decisions as senators, Madam Speaker, we are requesting that you adjourn the House for 5 minutes. We go and get those petitions by UHC, Madam Speaker. The strike is going on. Healthcare is crippled, Madam Speaker. They're not being responded to. The health minister is here, Madam Speaker.
Senator Eddie, please sit down.
Why can't we just adjourn for 5 minutes we make the decision?
Senator Eddie, please sit down. Order. What you're raising was raised by Senator Halwale, and the Speaker on the chair actually made a ruling on that. Senator Eddie, please sit down. It is my decision that we finish the questions and then we will do this. Please sit down. No. Can I invite the CS to answer the question?
Honorable Speaker, I did not send the UHC staff here. I met them.
Order, CS, can you answer the question, please?
Yeah, I met them last week, and they're here because the
Order,
budget is
CS,
making...
can you answer the question?
And I'll be very happy to receive the petition. Honorable Speaker, I want to thank the Senator for Nairobi. The second question, I think we are done. Give me, I can answer, but give me the documents. But let me just, for record and for the
CS, order, Honorable CS, you are now doing my job. The member requested that I give him an opportunity. Now you're answering on that. Can you just answer the question? Thank you.
I am exactly doing that. I am answering the question number 033 and 034 by the member for the Senator for Nairobi, Honorable Madam Speaker. The Ministry of Education engaged the former National Hospital Insurance Fund to provide a comprehensive medical insurance cover for all students in public secondary schools. This scheme was branded Edu Afia, commenced on 1st of May 2018, and was renewable annually for a period of 5 years, lapsing 31st of December. Honorable Speaker, this scheme was rolled out through the National Education Information System, NEMIS. There are several challenges that were found in that system. Fraud, misuse, double payment were made to health institutions arising from a single treatment. And if the Senator wants those information, I can provide the names and the institutions. As such, it was found to be unsustainable, and the government resolved to reconsolidate all these special schemes into one, the Social Health Authority benefit package. Therefore, Honorable Speaker and Senators, the consolidation of the Edu Afia scheme with all the schemes that were managed by the defined NHIF is geared at implementing the right to the highest attainable standards for all Kenyans, and further, the right of the child as envisaged under Article 53, Sub-Article 1C of the Constitution of Kenya, as read together with Section 16 of the Children's Act, which guarantees every child shall have the right to the highest attainable standard of healthcare services in our country. Honorable Speaker, under SHA, students belong to our household, and therefore they're eligible to benefit from the three funds. Honorable Speaker, on the last part of the question by the Honorable Senator for Nairobi, on Mr. Elios Majau Mlimuta, whose son, Master Robin Murimi Majau, a Form 4 student at Kibera Secondary School, passed away on the 9th of September 2022. May his soul rest in peace. The response is this. The comprehensive medical scheme for students in public secondary schools included a group life, the last experience cover in the case of the demise of the student. To access the benefit, the learner's next of kin was required to fill the last expenses and group life cover claim form, which were available from the school. The duly filed claim form was to be submitted to the Ministry of Education, sub-county, and county offices, which upon verification be forwarded to the Ministry of Education headquarters for second verification and then forwarded to the defunct NHIF. And I wish to state that SHA, in consultation with the Ministry of Education, have gone through the list of the claims submitted during the 5-year contract period they had and have not traced the mentioned claim. And I really want, because I don't want to give the benefit just to government, I want the Honorable Senator for Nairobi, in terms of the proposed way forward on this matter, I request Honorable Sifuna to provide the specific details, including the name of the full of the students, the student's name is number, the student's death certificate and burial permit, and the parent's contact, and I will follow up correct guidance on the last expenses claim process with the school and the parent and next of kin. I will do that and I will bring an answer. I mean, I think I am obligated to do that. Senator, if you provide me with those I have asked for,
Honorable Senator for Nairobi, you can actually come and provide. In terms of protection of the rights of the child, you may not read the particulars of the child. I hope you know that.
Yes,
and
I
you
understand
can hand
that.
over physically to the...
I understand that, Honorable Speaker. Just for the record, the entire process for the processing of the claim was followed, except the county director has refused to sign the certification by the county director for over a year. So I have the form here that has the details, including the name of the child, the name of the parents, and the contact of the parents. I have the form which they filled for the claim. I have the ID of the parent. I have a letter from the school. I have the certificate of death and indeed the permit for burial. Honorable Speaker, I wish that I table this so that the CS can receive it.
Please table it.
Thank you.
And Secretariat hand it over to the CS. Senator Manzo for the next question.
Thank you, Madam Speaker. This is my question to the Cabinet Secretary. A, could the Cabinet Secretary provide a detailed breakdown of the management and utilization of the Tobacco Control Fund, specifically outlining how funds have been received and allocated as stipulated by Section 7 of the Tobacco Control Act 2007. B, could the Cabinet Secretary provide information on the measures the Ministry has put in place to improve transparency and accountability in the administration of the Tobacco Control Fund, and how it plans to address the recent assessments indicating insufficient progress in advancing tobacco control efforts in Kenya in light of the influx of oral nicotine pouches, e-cigarettes, and such other products targeting the youth and children. C, in light of the 2015 court case under petition number 143 on the constitutionality of the tobacco control regulations, could the Cabinet Secretary provide details on how the Ministry has ensured compliance with the regulations, particularly regarding the solatium contribution from tobacco manufacturers and importers? And D, how is tobacco control being coordinated with the Ministry and across the country, especially in the context of devolution, Madam Speaker? Madam Speaker, with your kind permission, the answer was not in the bigger pile of answers which came in earlier. And while here, I've just seen annexures which have come out, but I'm ready to be guided by you, the Speaker, and the Cabinet Secretary. I thank you, Madam Speaker.
Cabinet Secretary.
Madam Speaker, let me on the onset say this is a very complex matter, and it's a matter I am dealing with, and it has many faces. So if the House will not be very happy with the answer I have been provided, I am ready and willing to come back next week, because my conscience is 50-50, so this House will help me. But let me just read what the ministry officials have given me. There are many, many issues I'm being asked outside there on this tobacco thing. Honorable Chair, the Ministry through the State Department of Public Health and Professional Studies oversees the regulations of tobacco products as stipulated in the TCA Act of 2007 and Tobacco Regulations of 2014, which is implemented by a body called Tobacco Control Board and the Division of Drug and Substance Control within the Ministry of Health. The Tobacco Control Fund, known as TCF, was established under Section 7 of the Tobacco Control Act, as the member have said. It's financed through parliamentary appropriation, forfeited properties, voluntary contribution, and mandatory solutium contribution from tobacco importers and manufacturers in our country in order to facilitate tobacco control initiatives, including research. The fund resources are supposed to be used for research, for public awareness campaign, for cessation programs, for enforcement activity. Currently, the solutium contribution remains the primary funding source, while efforts are ongoing to explore and implement additional funding streams. The fund is administered by the accounting officer or appointed official pursuant to Section 8 of the Act, and that is to ensure efficient allocation and utilization of resources. According to the records, in the financial year 2024-2025, an allocation of 831 million has been approved, and the annex is what we have provided for supporting the following key activities, both recurrent and development. There is a capacity building and nationwide public awareness. There is ongoing research application calls to inform evidence-based. There is the formulation of the monetary and evaluation framework. There is the establishment of the treatment and rehabilitation of centers in the 10 most affected counties: Nairobi, Nakuru, Mombasa, Laikipia, Kakamega, Eldoret, Meru, Machakos, Kisumu, and Kericho. There is the element of sensitizing healthcare workers and provide health product technologies, meanwhile as the process of tendering the putting of the infrastructure. These funds are also to be used to review the Tobacco Control Act. I am aware that a draft amendment bill is under the stakeholder validation. There is execution of the surveillance and enforcement, including multi-agency raids on shisha dens and successful prosecution. And Madam Speaker, I think, let me be very candid. I think Parliament must define what is multi-agency. This multi-agency thing, even when I was the leader of majority, is abused. It must be defined in law. Somebody just sits somewhere, he picks few, 5, 10 people from different agencies, and he tells you multi-agency. No, I think this country can do better. So Parliament must define what multi-agency is. Multi-agency is important, is key, particularly in the security sector. And the ones in the security sector have been defined. But you know, you can't walk to Ministry of Health or Ministry of Education and you say, on this matter, we will have a multi-agency. No, no. I think Parliament is the powers of lawmaking. We must define what multi-agency is. Otherwise, multi-agency is not in law. I mean, it's not been there. Nobody can tell me it's in that act. And this multi-agency thing started during the time of President Uhuru Kenyatta, and I think it should not, Parliament must must talk about it. There are areas like the security sector.
Okay. Okay, I thought you might want to bring it in your supplementary question. Okay, proceed.
To get to that, Madam Speaker, it is good that the Cabinet Secretary was very honest with what he said, and as I sit here, and as I present, Madam Speaker, documents are still coming to me, of which I need time to go through.
Senator Manzo, please sit down. That is, what we are doing is unprocedural. Let the CS finish, and then if you have anything additional, you will bring it in your supplementary. CS, have you finished? Please finish.
Chair, that's why I said this thing of tobacco is very complicated. So what are the measures that are used for transparency and accountability? To enhance transparency and accountability, the Management Tobacco Control Fund. The Minister has developed an operational manual guideline in 2022, and audits are conducted as per the Public Audit Act. Chair, let me not lie to this House, and I agree with the Honorable Member. I have not seen these guidelines. You know, I have not seen these guidelines. And I want to go unanswered. And then in terms of the dedicated Tobacco Control Fund Implementation Secretariat, it manages the day-to-day operations, maintains financial records, and ensures regular reporting too. But I think the House should not worry because I am on it this thing. It will either straighten up or it will fold. It cannot be business as usual. It's one of the things which are on my table. Many things, including a letter from the DCI on inspection. So I'm studying that. But because I had to come to the House, I had to find a way. So I'll talk to my PS and the people concerned, and we must speak to the people of Kenya on what is going on.
Honorable CS, can you just hold on for 1 minute?
So I will.
Honorable CS.
Chair, can I ask you?
I'm just requesting you give me 1 minute. Sit down first. Honorable Senators, in view of the interest by Senators in the matters currently under consideration, I direct that the Senate extends today's sitting for no more than 15 minutes pursuant to Standing Order 34-2A. Proceed, CS.
So, Chair, I think this, I will ask you, Chair, that this tobacco thing, with the analysis of the member who asked me, I be given more time to find out and even come with the Auditor General's report on this fund and all the story behind it, because even me, I have not really digested and internalized this thing, and I don't want to cheat the House because I am unanswered. Tomorrow the same House can hold me to account. If I seek the approval of this House, I will be told I have said this and this. So can we, with the indulgence, can we step down this tobacco thing? I can still ask, if the members want to ask questions, I can take the notes, but I think this tobacco thing I need to find out what's
Thank you, CS, for being so frank. And in fact, a member was going to ask for some annexures that you've not brought. Members, I suggest that this is a serious issue. We step down that question and allow the CS to provide a comprehensive response. In this House, CS, you'll want to know that I think even before the House, there is a bill that deals with tobacco control. So I think the House would want majority.
Speaker, I beg your indulgence because I have additional requests still on this tobacco issue to the Minister, and there's something that he has alluded to. This, can I just make it as a request so that as he brings additional information to the House,
That is fine. That is fine, your majority leader.
There is something is not right at the Tobacco Control Board, and I'd wish that the Minister listens keenly to this request. And I like the fact, Madam Speaker, that the Minister has actually alluded and spoken on this thing called the multi-agency. As representatives of the people, we sometimes come into contact with information that is useful for Cabinet Secretary to know. I know for a fact that there is a certain dispute that exists presently before a tobacco importing company and this board. A company that went through all the legal procedures, paid their taxes, then somehow one day, one afternoon, this so-called multi-agency that the minister is speaking to show up at their warehouse, confiscate goods, goes to the Department of Public Health, falsifies documentation and claims that there is some drug and substance that is in the products that this company had imported. Therefore, putting into question so many other agencies that had prior approved those products to be on the shelves of this republic. That matter has been investigated by the DCI. I am aware that they have filed a response back to the ministry, and they have confirmed that that multi-agency actually misled the country. I would wish that when the minister comes back to this house, they bring the findings of the DCI with them and tell us what will be done to those officers that led this kind of cartel-like operations where we can use government agencies to falsify records on health matters. I thank you, Madam Speaker, for indulging me.
Secretariat, I direct that this question be rescheduled with all the aspects that have been raised by the members. We now move on to the supplementary questions by those who submitted the questions. Senator Manzo, do you have a supplementary question? No, you are, sorry. Yours is not there. So I don't see Senator Sifuna, neither do I see Senator Ojenda had actually delegated to Osotsi Faki, Senator Faki.
Asante, Bi Speaker. Waziri, asante kwa ujio wako asubuhi ya leo. Na swala langu ni kuhusiana na malipo ya SHA. Kwamba inakuwaje wakati mgonjwa kwa mfano anafanya operation, SHA inasisitiza kwamba lazima alipe malipo ya zaidi ya miaka 2 ndio aweze kupata huduma ambayo anahitajika kupata, either ya operation ama ya kulazwa kwa matibabu fulani ambayo ni ya kitaalamu. Hiyo imeweza kufanyika kwa sababu nimepata malalamiko mengi kutoka kwa wananchi kwamba wanalazimishwa kulipa zile subscriptions za mpaka miaka 2, miaka 2 na nusu ndio waweze kupata huduma hiyo kutoka kwa hospitali zao. Asante, Mheshimiwa Speaker.
We'll ask a number before you answer, CS. Senator Oruoba.
Thank you, Madam Speaker. Madam Speaker, I have a concern, a question about Linda Mama. Waziri, I know you mentioned and elaborated about how Linda Mama has been absorbed into the bigger cover. Waziri, I've had the privilege, or is it the advantage, of being pregnant in this particular transition. And I don't know whether you know that that comprehensive cover that you are saying is there for Linda Mama, or that covers prenatal and postnatal, actually doesn't exist in totality. Waziri, I'm not sure if you are aware that some of the prenatal services that you have quoted are not given under that comprehensive cover. For instance, scans are not covered. A pregnant woman requires a minimum of 2 scans before they give birth. That is not covered in the cover that you are talking about. Also, when you have postnatal, and my question is...
No, you only ask one question, please. Can we move to the next person?
But I've not, Madam Speaker, unless you are going to answer the question, you are going to ask the question. I've not asked it.
You are supposed to ask a question.
I have not asked it. You have asked. I have not asked the question. Madam Speaker, allow me to ask the question.
Okay, proceed.
My question is, Waziri, my question is, have you actually given a service charter under this comprehensive prenatal and postnatal care so that we can be able to tell you, those of us who have been pregnant, which services are being given and which services are not being given? So that is my question to you, Waziri.
Yes, yeah. Order, Senator Oruoba, please. Senator
Madam Speaker, my supplementary question is pretty much interlinked with the first question that was asked by Senator Sifuna, and is on the UHC workers, Madam Speaker. And Madam Speaker, my question is very simple, but I don't want wounding answers from the CS, because the question is, what is the CS doing to resolve this crisis and strike that we are seeing with the UHC workers in the context, because in the context of, number one, making sure that if the CHC workers were going to be transferred to counties, there is harmony of them being put into the payroll nationally, the same way we have seen with community healthcare workers on the portion that the government takes care of. And number two,
only one question.
It's
Senator
one question.
Eddy, please. Senator Eddy, please sit down.
Madam Speaker, allow
Senator
me just
Eddy, I have ruled. Please sit down. No, it is one question, and you have asked it. Senator Miraj, please. Okay, proceed.
I beg your indulgence, because the reason why they're striking is very important. The second part of this, Madam Speaker, is that there is budgeting process going on right now for these UHCs. Why they are rioting is because...
Please ask a question.
So the question
Don't
is
explain.
the CS going to make sure that they are put into a permanent and pensionable program in this budgeting cycle? Thank you, Madam Speaker.
Senator Miraj.
Asante, Bi Speaker. Swali langu kwa waziri litakwenda moja kwa moja kama mkaazi wa gatuzi ya Mombasa. Tuko na faraja ya kwamba sisi tuko na referral hospital ya Coast General. Lakini tatizo ambalo linaendelea pale kwenye hospitali yetu, Bwana Waziri, ni kwamba wagonjwa wananyimwa huduma. Wananyimwa huduma hivi ya kwamba wanapofika wanaulizwa maswala ya kwamba kama
Senator Miraj, ask a question, please.
Si ndo najieleza, tafadhali.
Uliza tafadhali.
Swali langu ni kwamba kuna ushirikiano gani wa karibu baina ya wizara na gatuzi ya Mombasa, kwa sababu anayepeana huduma pale CEO anasema ya kwamba hamupeani pesa za SHA wanapotibu wagonjwa. Kwa hivyo wagonjwa ambao wana uwezo wanalipishwa pesa zaidi. Bill zimekuwa kubwa, radiotherapy haifanyi. Yani Mombasa, waziri, kama ingewezekana, mimi kama mwakilishi kutoka kule, naomba ufike Coast General. Maafa yamekuwa mingi, hakuna manasi. So,
you have asked the question. You have asked the question. Now you are
ushirikiano gani wa karibu?
Order, Senator Miraj. Honorable Senators, I would like to acknowledge the presence in the public gallery this afternoon of visiting teachers and students from Kiburu Boys High School. Order, Senator. A boys' high school in Kirinyaga County. The delegation comprises 3 teachers and 49 students who are in the Senate for a one-day academic exposition. Honorable Senators, in our usual tradition of receiving and welcoming visitors to Parliament, I extend a warm welcome to them, and on behalf of the Senate and on my own behalf, wish them a fruitful visit. Thank you very much. Senator Kavindu.
Thank you, Madam Speaker, for giving me this opportunity.